Hi, I'm Hannah from Hands on Health. We're going to be talking about plantar fasciitis. So what is it? Plantar fasciitis is the inflammation of the plantar fascia, which is a thick connective tissue on the sole of your foot. So if I bring in my skeleton here, you can see it goes from the heel bone, from the side, it goes from here, and it comes up and it attaches to the base of the toes, right? So the symptoms you can expect with that sort of thing would be pain on the heel of your foot, on the bottom of your heel, so right in there, on this part here. But you can also have symptoms further along the foot. This sort of, the plantar fascia, it helps support the arch along here, along the inside of the foot. So you can expect to have some sort of symptoms that are closer to the heel bone, further away from the heel. Sometimes it feels like it's kind of almost traveling down. But the important thing is it can vary. It's one of those pains that's there when you wake up in the morning, you go to put your foot down to get out of the bed and it's there and it's very intense, and it can be a rubbish way to start your day. So the causes of plantar fasciitis, again, they vary. So it can be things like a repetitive strain type injury. That can include walking barefoot on hard floor. If you have particularly tight calves, that can also increase the risk of having plantar fasciitis. Or if you're wearing poor footwear. And what I mean by poor footwear is things that compress the toe box. So pointy shoes, high heels, or something that lacks a lot of cushioning on the heel. Because the more cushioning you have there, it helps reduce the shock that goes through the foot as we walk. Because when we walk, it's heel strike first. So how can we help? Here at Hands on Health, we can conduct a thorough case history, identifying things that make it better and things that make it worse, and how long you've been dealing with this problem. Because typically plantar fasciitis can be around for some time before you think you've tried all the tricks in the book, you've tried Googling it, you've tried talking to the GP, and it can leave you feeling frustrated because it's not progressing anywhere. So we can look at the bigger picture, and by looking at the bigger picture, we can then identify what the cause is and address it. Treatment will involve an assessment of the foot and the ankle to look at the mechanics of the foot, to see how it's moving. And we will also be looking at the knee and the hip, and then also the low back as well. Because something as far up as the low back can have a compensatory effect further down the chain. So by looking at the bigger picture, looking at everything together, we can then give you a more holistic treatment. Instead of just treating the foot and the ankle, we're looking larger, we're looking at the whole limb to prevent it from coming again in the future.